My name's Lynn. I'm going to be your nurse this afternoon. Can you tell me your name and your birth date, please?
Luke McKenna, 08/31/01.
Okay. And Luke, do you have any pain right now?
No, just a cold.
You have a cold? Okay. Okay. Well, we're going to do a full body assessment on you to check you out and see how you're getting along, and maybe you'll get to go home soon. Okay? I'm going to go ahead and wash my hands, and I'm going to put on some gloves. Did you sleep well last night?
Mm-hmm.
Mm-hmm. Okay. Just going to clean this off here. And I would normally start out with a set of vitals on you, taking your vitals. But I'm not going to be doing that for our recording here today. Okay? So first thing I'm going to do is I am going to check your scalp and see if you have any lesions, bumps, or bruising. Do you have any pain in your head?
No.
Okay, and there's no parasites, so that's good. That's good. Can I look in your ear here? And I get the pen light here. And look in your ear. Okay, can you turn your head the other way? Can you look in this ear? Okay. And do you have any pain in your ear? No?
No.
Okay. And they're even, and they're correctly spaced, so that's good. And I'm going to go ahead and look in your eyes here, at your pupils. Okay, so I'm going to shine this light in your eyes, one at a time. And so I'm just going to have you, I'm just going to turn it on here and see if your pupil is equal, round, reactive to light, accommodating. Yep, that eye's good. This one, that one's good. Okay, and can I have you follow the pen light here? Just with your eyes. Good job. Good job. Okay, and I'm also, while I'm doing this, I'm assessing your skin at all times. Just checking on coloring, the condition of your skin, your nutritional status, your behavior, your orientation, possibly like your mood, if there was something I could tell if your mood was different. I'd be assessing that all along as we do this, and you're obviously very oriented. I'm going to just check out your eyes and see that they're white, and your cornea, your iris, all of that is good. I'm gonna look in your nose now. Okay, I know you have a cold, but do you have any pain in your nose? No? Okay. Well, you're not having any nasal flaring from trying to breathe, so that's good. That's good. And now I'm going to look at your mouth. Can you say ah? And stick out your tongue. Good job. It's moist. It's pink. You have your own teeth. That's good. Do you have any pain in your throat? No pain. That's good. That's good. I'm going to feel your lymph nodes and your carotid pulse while I'm here. That's all good. Have any pain when I do that?
No.
Okay. And I'm going to have you turn your head to the left here. Check on your right side for your, see if you have any jugular vein distension, and you don't, so that's good. Okay, we're good with that. So now I'm going to look at your chest, and I'm just going to look at it to see if you have any problems when you're breathing, where you're having to help yourself breathe. Your chest is having issues while you're trying to breathe. I can't come up with the word right now. And I can kind of see, you do have a cold, but you're actually able to breathe. So we're just going to tie this here so we can help you out here. Okay? And the coloring is good. I'm going to take a listen to you right now, and I'll ask you to take some breaths, okay? As we do this, I'm going to go ahead and I'm going to do your apical pulse first, and in a kid that's at the 4th intercostal space, but in adults it's in the 5th intercostal space, mid-clavicular line. So I'm going to go ahead, and I would normally listen to that for 1 minute. But we're going to fast forward, and we're not going to listen for a full minute this time. But I would check his S1 through S5 for his heart. Okay, that's all good. And now since I have you up front here, I'm going to go ahead and listen to your lung sounds. There's 8 in the front. You take a deep breath. Good job. Another one. Good job. Good job. And I'm going to listen. Get a cough? Do you need a cough?
I'm good.
You're good? Okay. I'm going to listen to your side here. There's 4 on each side. Can you take a deep breath? Okay, good job. Now this side. Okay, and now I'm going to have you sit up, and I'm going to listen to your back. And I'm actually going to have you slip this at least one arm out so I can look at the skin on your back and make sure you don't have any skin issues or problems that way. The coloring's good. You don't have any marks from being in bed, pressure ulcers, things like that. Okay. And since you don't have any catheters or bandages or IVs, I won't be checking on those today, but I would normally look at those too to make sure that they're patent and that there's not infection or infiltration, anything like that. Okay, so I'm going to go ahead and I'm going to listen to your lung sounds on your back, and there are 10 of them on the back. So can you take a deep breath? Good job. Good job. Okay, lean back if you want. And I am just going to look at your arms here, see if you have any swelling, any edema, things like that. In either arm. Your range of motion is good in both your arms. Can you do that? Good job. And strength, can you squeeze my fingers? Good job. Good job. Okay, and like I said, you don't have any IVs or things like that, so we don't have to check that today. I am looking at the color of your skin, the warmth of your skin. I'm going to check your fingernails. I'm going to do the cap refill, and that is good. It's under 3 seconds, so that's very good. So that's good. We can move on from there. Now we're going to, I'm looking at your abdomen. And I don't see any distension. The coloring's good, no bruising, things like that. And so I'm going to listen to his abdomen. There's 4 areas that would listen to for his bowel sounds. And you don't have to do anything. Oops, I'm going to start here. Sorry, start on the wrong side. Just be normal. And I hear bowel sounds, so that's good. Then I'm going to feel his abdomen, and it feels like it should, soft and normal. So that's good. And then I'm going to palpate his bladder here. Do you have any pain when I do that? No? Good. That's what we like to hear. So good job. So you can cover up there. And next I'm going to move down to your legs. Still see you in the video here. I'm going to turn it just a little bit, so hopefully we can get down by his feet yet. Okay. So we're looking at his legs. The coloring is good. Still the same pink color that he has up above. And he's warm to the touch. He has no edema in his legs. Can you check your range of motion? Can you bend your knees a little bit for me? Any problems with that or pain?
No.
No? The hair distribution is even. He does not have edema, like I said. I'm going to go ahead and take off his socks here. And I'm going to be checking his cap refill in his toes. His toes are a little colder than his legs. I can tell that. That could just be because it's cold. Nope, he's got good cap refill there. Okay, do you have any pain as I do that? Okay. And I'm going to put my hands here, and I want you to try and move my hands. Good job. Move my hands there. Good job. All right. And I think, so your feet are good. You don't have any bandages, so I won't be looking at those. And I am going to go up top here. I did forget to do your pulse, a couple of your pulses, so. Back up here. And so we would do the brachial pulse and the radial pulse at the same time, and we would compare the rate and the strength to the apical pulse. And we're comparing these two to each other, both sides to each other at the same time. Okay, and I'm going to do his radial. Oops. There we go. And I'm just comparing both sides to each other. And that's good. They're both even and regular and strong. Okay. Do you have any questions for me? No? Okay. Trying to think if there's anything else that I need to ask you now for your assessment at this moment. And I think that might be it. I'm going to, oh, I didn't have one thing. I was going to ask you when you had your last bowel movement.
Yesterday.
Yesterday, okay. And was it normal for you?
Yeah.
Okay. Okay. And so then you're passing gas too as well.
Yes.
Not a problem with that. Okay. And urination is okay?
Yes.
Yep. And do you drink a lot of fluid during the day?
Yes.
Yep. Yep. Okay. Well, I am going to go ahead and cover you up here and make you comfortable. And I'm going to give you your call light so you can call me if you have any questions or you need something from me. And I'm going to document the file, your file, to let the doctor know how your assessment turned out. And hopefully if things go well, he'll be ready to send you home. Okay? Okay, so I'm going to go ahead. I would take off my gloves and I would wash my hands.